Hello. Good morning or good afternoon, depending on where you're calling in from. I am Catherine Alfano, the American Cancer Society Vice President for Survivorship. The American Cancer Society is pleased to be a partner on the BWEL Study. For us, healthy eating, physical activity, and managing weight are central to our mission to prevent cancer, save lives, and diminish suffering from cancer. I have the delightful job of welcoming you all to the call today. Let me start with a few housekeeping notes. If you have any technical issues during the presentation, use that lower right-hand Q&A box that you should see on your screen right now, and send a message to all panelists, and our producer will help you with the solution. And if you have questions about the content of the presentation that come up while you're hearing it today, please type your questions in the Q&A box and be sure to send them to all panelists. And we are aiming to have time to address all of your questions at the end of the presentation. Also, we'll be recording the presentation and housing it on the BWEL Study website for anyone who wants to see it again, or for the participants who could not attend. So if anyone's frantically taking notes out there, don't worry. You can listen to the material again and again as often as you'd like. And now, without further delay, I would like to introduce my colleague and friend, Dr. Jennifer Ligibel from the Dana-Farber Cancer Institute, who is the lead investigator on the BWEL study. Dr. Ligibel will be presenting on diet and breast cancer, separating fact from fiction. Dr. Ligibel, over to you.
Thank you very much, Catherine, and welcome everyone. We are really happy to have you join us for our first participant webinar for the breast cancer weight loss trial. It says spring 2017, and we did manage, I think there's a few days left in spring. We are planning on having webinars every 6 months. It took us a little while to get this first one up and off the ground, like it often does with the first time you do something, but we will be hosting another webinar probably right after the new year to help everyone with their New Year's resolution. So please stay tuned for announcements for that in the future. But today we are going to be focusing on diet and breast cancer, separating fact from fiction. And what our goals today over the next 45 minutes or so will be to review the evidence from clinical studies that diet is linked to both preventing and to treating breast cancer. And just as a little bit of a forewarning, we are going to talk about a number of different research studies. I think it's important to know that there's been a lot of work that's been done in this area to try to sort out, are there foods that are better for you, are there foods that are worse? We're really going to talk about what is the real evidence from people, from animals, to try to put this all together. And then at the very end, we'll put it all together and think a little bit about what current dietary recommendations for breast cancer survivors should be based on evidence from these studies. So the reason that this is important, and I think all of you know this, is that there's a lot of information out there. Sometimes it seems like you can't turn on the television or open a magazine, especially in the month of October, without getting some advice about what you should be eating or about what kind of foods may have contributed to breast cancer happening in the first place. And some of this is good because I think it's important that there's a lot of interest in this area, that people are recognizing that cancer isn't just about medications, but at the same time, it can be really confusing. It can be hard to know what you should actually be doing, because sometimes if you read an article all the way through, you'll get recommendations that seem to contradict each other. You should be eating soy, you shouldn't be eating soy. Sometimes it also leads to a diet that's kind of impossible to sustain over time, and then people feel bad if they can't stick to a diet that has no sugar at all, or that's all organic and is costing $1 million. So I think it's really important to take a step back and think about, well, what is really based on evidence? Because unfortunately, the reality is that when you're talking about diet, it's a little bit like religion. Sometimes people have very strong feelings, and sometimes it's based in science, and sometimes it's not so much. So what we're going to try to do today is look at what we really know about diet and breast cancer and come up with some thoughts about a healthy eating plan for people that have had breast cancer in the past. So when we think about sorting out what is fact and what is fiction, we're going to think about whether there's an optimal diet to prevent breast cancer in the first place, and then focus mostly on If you've already been diagnosed with breast cancer, does it matter what you eat at that point? So we're going to start with a fact, and I think that this is reassuring that there really has been a lot of research that's been done looking at connections between diet and breast cancer. So sometimes if you read a book, they'll say, well, we know this is really helpful, but there's just not been any research, and that's why there's no evidence that this particular diet is what could cure breast cancer. And I really want to poke a hole in some of those claims, because the reality is there are thousands of studies that have gone on looking at links between different dietary factors, different foods, and breast cancer. And so the problem isn't that there isn't evidence, it's that sometimes the types of studies that have been done don't really give us a clear answer about a particular diet that may be preventative or causative. So as a bit of background, we're going to talk about the kind of research that's been done that's been looking at these links between diet and breast cancer. We're going to talk about 3 different types of trials. We're going to start by talking about randomized trials, because these are really the types of studies that can definitively prove whether there is a link between a dietary factor, a food, a way of eating, and the risk of either developing breast cancer or the risk of it recurring. Now we're going to talk about other types of studies that can give us some of the preliminary evidence that then is tested in these bigger randomized trials. So a randomized trial is a study that enrolls a group of women who have similar characteristics. So maybe they've all been diagnosed with the same type of breast cancer, or they've had the same type of treatment. And it takes these women and it divides them into groups or randomly assigns them. And in the type of research we're talking about, one group of women is assigned to change their diet in some way, like eating more kale or not eating as much fat, or they're assigned to a comparison group. And the comparison group isn't told that they need to have a bad diet, but they're just not told that they should change their diet. And this is the kind of study that BWEL is, where you're enrolling a big group of women, and you have one group of women that you tell should make changes, and the other group you encourage them to have healthy lifestyle, but you don't give them a specific plan. And then you look over time to see if the changes that you have recommended make a difference. Now, the good thing about these types of studies is that this is really the only way to know definitively whether a change in diet could impact what happens down the road. Because if women are pretty similar, or the people that are taking part in the study are pretty similar at the beginning of the trial, and you're changing one thing, that allows you to learn more about, well, how does that one thing affect somebody's risk of developing cancer or the risk of it coming back. The bad thing about these trials is that they take a really long time. You have to enroll a big group of people, you have to follow them for a long time, they're complicated studies to do, and usually you can only study one thing at a time, because if you had somebody eat a diet that had a lot of kale and had a lot of soy and didn't have any fat, you wouldn't really know which one of those things it was that had an effect on what happened down the road. So a lot of times you need to do a lot of different studies to really learn about the effect of diet, which is very complicated, on cancer. And so this is why randomized trials aren't the only way that we can learn about how diet is linked to breast cancer. Another very common type of study that is used to look at how diet is linked to breast cancer are what is called observational studies. And in this kind of study, a very large group of women, sometimes 10, 20, even 100,000 people are enrolled in the trial, and they're asked, what kind of food are you eating? How often do you eat vegetables? How often do you eat fruit? What kind of fruits and vegetables are you eating? How many times a week do you eat sweets? So it looks at kind of all the different factors of diet, and then it follows people over time, and it sees who developed cancer and who didn't. And then you can look at whether there are patterns between the types of foods people were eating and what happened to them. So you're not asking anybody to change anything, but you're kind of looking at patterns of what people are eating and whether cancer or other diseases develop. Now, the good thing about these studies is that these are really big trials. So you can enroll all different kinds of patients. You can learn a lot about a diverse group of people. You can study a lot of different factors at the same time because you have so many people. But the bad thing is that when you're looking at a lot of different things at the same time, you really can't sort out what is a direct effect. You can think about whether there are links, but you don't get that cause and effect. You don't know if a change makes a difference. Because it might be that women who eat a lot of kale, who don't eat a lot of sweets, also do other things differently. They may exercise more. They may be more likely to go get their mammograms. So in this study, the women might not be the same in the different groups, and so it makes it harder to know if there's a direct relationship or if something is affected by another factor. It can give us very important clues, however, that then can be tested in other kinds of studies. And then the last type of trial that we're going to talk about today are what are called laboratory or animal studies. And in these studies, some type of animal, which are usually either mice or rats, are exposed to a very high level of a particular type of food. And then the scientists can look at whether that influences the risk of cancer occurring or of cancer spreading. The pro of this kind of study is that in a mouse or a rat, you have complete control of what that animal is eating. So it's not like you think that the patient is on a high kale diet, but really at night they're eating a lot of ice cream. There's no way that the mice are doing anything that you're not directly giving them in terms of food. And you can also look at how much they're exercising and all those other things. But the bad part is that sometimes it's hard to equate the amount of a nutrient that you're giving to a mouse or rat to what happens in people. That control also sometimes is bad because we know that what happens in mice or rats is so different than what happens in people in the real world when it comes to diet. And we also have known for a long time that we're really good at causing cancer in animals and in curing it, but that hasn't necessarily translated to the same thing in people. So again, this type of research is really important because it can tell us whether there's any possibility that there's a link between a food and cancer, but it doesn't necessarily mean that what you're going to see in rats is the same as what you'd see in people. So with that background, I want to move on to think about, do we have any evidence from these studies that changing someone's diet could actually prevent breast cancer? And I'm going to start with prevention because there's actually a lot more research that's been done to this point in people who don't have cancer, looking at whether changing diet could affect the risk of cancer developing than there is in people who already have cancer. So we're going to start with these types of studies because there's a lot we can learn from them. We know from other research that many of the same factors that influence somebody's risk of developing cancer in the first place is also linked to the risk of that cancer coming back. So I'm going to start with the biggest study that's actually ever been done looking at whether changing someone's diet could have an effect on the risk of developing cancer. And this was a study called the Women's Health Initiative Low-Fat Diet Study. This was a very large trial that was designed to test whether if you took someone's diet and you lowered the amount of fat in it and increased fruits and vegetables and fiber as a secondary objective, whether that could change their risk of developing breast cancer, colon cancer, or other cancers. So the people that took part in this study were all women. They had to have gone through menopause, and they needed to eat at least 32% of their daily calories as fat. Now that may seem like a lot, but in the United States, actually, the average person gets somewhere between 30 and 40% of their daily calories from fat. So this was actually a pretty typical U.S. diet. So this study enrolled almost 50,000 women. So this was a huge trial, very big effort, took place over many, many years. These women were then randomized to either a low-fat diet group, and about 20,000 women were put in that group, and then about 30,000 women were told to keep eating their regular diet over time. They weren't told that they needed to stick to eating a higher level of fat, but they weren't given lower fat goals. So one of the first things when you're doing this type of study that's important is to see, well, did your dietary program actually change the way people ate? Because you really can't study the effect of a low-fat diet, for example, on the risk of cancer if nobody really is eating the low-fat diet. So one of the first things that the study showed was that the diet program did have an effect on the diets of the women who were taking part in that group. So the women in the low-fat diet cut the fat they ate by about 13%. So this was a relatively modest change. If they started at 32%, 13% of that is only about a 4 or 5% total reduction in fat. And they also ate about 1.5 more servings of fruits and vegetables a day. So they did change their diet. And this was in comparison to the usual diet group, who also did cut their dietary fat by a little bit, by about 2%, and ate a little bit more fruit and vegetable a day, a little bit less than half a serving. So there were definitely changes between the two groups, although they weren't enormous changes. And unfortunately, when they looked at what happened over time, when they followed these women for many years, they found that there was no difference in the overall risk of developing cancer for the women who took part in the low-fat dietary program versus the women who were in the usual diet group. When they looked specifically at breast cancer, they did see that there was a slightly lower risk of developing breast cancer. It was about a 9% reduction in the risk of developing breast cancer. But the study was actually designed to see a much bigger benefit of the diet in terms of reducing the risk of breast cancer. And the difference that they saw was so small that it was impossible to rule out that that had just happened by chance. So unfortunately, the study was regarded as sort of failing to show that changing diet resulted in improvements in breast cancer rates, so a reduction in the risk of breast cancer or other cancers in these women who took part. However, there was a more recent, although much smaller study, which also looked at whether changing diet could reduce the risk of developing breast cancer. This was a study that looked at a different kind of diet. So instead of a low-fat diet, this study looked at what's called a Mediterranean diet. Mediterranean diets have some things in common with low-fat diets. They really encourage vegetables, lean protein like fish, but they use olive oil and other healthy oils. They also look at reducing red meat in processed food, and they include a little bit of wine. And we're going to talk later in this talk a little bit about alcohol and breast cancer. But in this study, participants were encouraged to drink a little bit of wine as part of their dietary program. Now, the main goal of this study was not to look at the rate of breast cancer in people that were assigned to this Mediterranean diet, but it was actually a study that was designed for both women and men to look at whether this diet would lower the risk of heart disease, which it did do. But as a secondary goal, the study also looked at in just the women who took part, whether women who were assigned to this Mediterranean diet group had a lower risk of developing breast cancer over the course of the study. So the people who took part in the study were assigned to one of 3 groups. 2 of those groups had a Mediterranean diet. One of them had a Mediterranean diet with extra virgin olive oil. And the other group had the Mediterranean diet plus nuts. There has been a lot of research that have suggested that nuts also have healthy fat, and they've been tied to a lower risk of heart disease. So 2 of the groups had a Mediterranean diet, either with olive oil or nuts, and then the 3rd group was assigned to a usual diet. Now, this was a much smaller study than the Women's Health Initiative, and there were only about 4,000 women as opposed to 50,000 women that took part in the trial. And what that meant was that there were not very many women in this study overall that developed breast cancer, only 35 of them during the time that they were following women after the start of the study. But what they saw was that the women who took part in the Mediterranean diet groups had a lower risk of developing breast cancer compared to women in the usual diet group. Women in the olive oil group had a 62% lower risk of breast cancer, and women in the nut group had a 38% lower risk. Now, it's important to recognize that if there were only 35 total breast cancers, that a 38% lower risk could have been 2 or 3 cases of breast cancer. But I think this study is really exciting in that it suggests really for the first time that changing your diet could actually have an effect on cancer risk. There are bigger studies that are in the works to test this, but I think this offers us some really hopeful early evidence that diet really is important when it comes to breast cancer. So moving on, I know that the BWEL trial focuses on women who've already had breast cancer, and a lot of my patients ask me, Dr. Ligibel, does it make a difference? I already have breast cancer. Does it make a difference what I eat now? And I think that we really do have a fair amount of evidence that shows that diet still makes a difference after you've already been diagnosed with breast cancer. So it's not just breast cancer prevention in the first place, but also prevention of recurrence where diet can make a difference. So on this slide, you see a lot of different trials that have observed connections between dietary foods or dietary nutrients and the risk of developing a breast cancer recurrence and dying from breast cancer in women who've already had breast cancer. So these studies, again, were not randomized trials like the two we just looked at, but they were studies that observed thousands of women with breast cancer to see what they were eating and how that was linked to what happened with their breast cancer over time. Now, to understand what this graph means, so what we see here, this gray line represents no relationship between a dietary factor and breast cancer. So if you see that dark circle sitting on this gray line, that means that whether you ate more or less of a particular factor, there was no link between that and the risk of breast cancer recurring or dying from breast cancer. If you see that the dark circle falls to the right of the line, that means that women who consumed more of whatever the type of food was had a higher risk of their breast cancer coming back. And if the dark circle fell to the left of the line, that meant that there seemed to be some protective effect of that food group on breast cancer. It's important to remember, again, that these things were all from studies where patients were observed and not changing diet, but you can see there's a lot of different studies represented here. So what do these studies show? So first of all, alcohol, which we talked about, has definitely been linked to the risk of developing breast cancer in the first place. And in fact, there was just a big study that came out 2 weeks ago, an analysis from the American Institute of Cancer Research and the World Cancer Research Foundation that looked at all of the different studies linking alcohol to the risk of developing breast cancer. And that shows pretty consistently that especially at higher levels of daily alcohol, 2 or 3 drinks a day, there's a pretty clear link that if you drink more alcohol, you're at higher risk of developing breast cancer. What this study that we're looking at right now looks at is, well, what's the link between drinking alcohol after you've been diagnosed with breast cancer and the risk of dying from breast cancer in the 5, 10, 15 years following diagnosis? And what these studies show is that there really doesn't seem to be such a consistent relationship between alcohol intake and the risk of developing a breast cancer recurrence. Now, most of these studies looked at a pretty modest level of alcohol intake, so a drink or less a day, but you can see that there doesn't really seem to be a consistent relationship between drinking a modest amount of alcohol and a higher risk of breast cancer recurrence. The same thing is really true for carbohydrate intake. There aren't so many studies, and they've had a little bit of mixed results, but there doesn't seem to be a clear link between higher levels of carbohydrates, so sugars and starches, and the risk of breast cancer recurrence. There does seem to be a little bit more of a link between fat intake and breast cancer recurrence, and you can see that many of these studies that looked at this, but not all, suggested that women who ate more fat seemed to have a higher risk of their breast cancer coming back compared to women who ate lower amounts of fat. The opposite is true for fiber, although not very many studies, but the studies that have been done do suggest that diets that have more fiber seem to be linked to a lower risk of breast cancer recurrence. That might also be true for protein, although some studies really suggest not a lot of relationship at all between protein intake and breast cancer recurrence. Now, what's hard with these studies is that many of them looked at different factors in the same patient group. So sometimes it's hard to know, is it the fact that the patients were eating more fat, or is it really that they were eating less fiber that was an issue? And I think that we don't really know that from these types of studies. But again, I think that this gives us more information that diet is important even after you've been diagnosed with breast cancer. So I want to focus now, rather than looking at more general categories like protein and fat, about whether there are any specific foods that have health benefits or health risks for women who've had breast cancer. And I think, again, starting with a fact, is that despite all of the headlines about specific foods being cancer-fighting or cancer-causing, most of the research that's been done looking at specific foods and how they're related to breast cancer was done using breast cancer cells in test tubes or in animals, and there's very little research that's shown that any particular food causes breast cancer or prevents breast cancer in people. But I'm going to take a specific example because this is one that has many times gotten a lot of headlines, and this is broccoli, specifically broccoli sprouts and the nutrients that are found in broccoli and broccoli sprouts. So in these experiments, there were different kinds of breast cancer cells that were grown in labs, and there's actually been a lot of research where different types of breast cancer, hormonally driven breast cancer, triple-negative breast cancer, HER2-positive breast cancer, scientists can actually grow those breast cancers in a test tube or on a culture, and then they can test what happens if you expose those cells to different types of substances. And this type of research is used a lot when new drugs are being developed, but it's also been used to test whether there could be anti-cancer properties of certain foods. So in these experiments, breast cancer cells were exposed to different concentrations of nutrients that were isolated from broccoli. And what the scientists found was that at high concentrations, the growth rate of breast cancer cells was slowed and cells had a higher death rate. So these broccoli nutrients actually had an effect of killing breast cancer cells in test tubes, which sounds pretty exciting. This led to more research in animals, and there were experiments looking at giving broccoli nutrients to rats. And one example of that was a study where they took young female rats and they divided them into groups. Some of them were given nutrients that were isolated from broccoli, and some were given more typical food that didn't contain any broccoli nutrients. Then the scientists exposed all of the rats to a chemical that causes breast cancer. And this is a very common way that these types of experiments are done in mice and rats, is to use a chemical that causes breast cancer. And what the scientists found was that rats that were given high doses of broccoli nutrients were about 50% less likely to develop breast cancer compared to the rats that were not given the broccoli. So again, another piece of evidence suggesting that broccoli could potentially prevent breast cancer. So what about in people? Unfortunately, there are no studies testing what happens in women when you add broccoli to their breast cancer. When you add broccoli to their diet to look and see what happens in terms of their risk of developing breast cancer, or of looking at women who've already had breast cancer, whether it's more or less likely to return if women are given a diet that's infused with broccoli. However, there have been several studies that have asked women without breast cancer how much broccoli they ate, in conjunction with asking them about other fruits and vegetables. And unfortunately, unlike the animal studies and the test tube studies, these studies in people have not been at all consistent. Some studies showed a slightly lower rate of breast cancer in women who ate the most broccoli, whereas other studies showed no relationship at all between the amount of broccoli that people ate and the risk of developing breast cancer. So this is puzzling in some ways, but it also says a lot about what the headlines say. So despite the fact that we really don't have any evidence in people that broccoli lowers the risk of developing breast cancer, you find all kinds of articles and stories about worried about breast cancer, eat your broccoli, 9 foods for breast cancer prevention. Broccoli and breast cancer prevention is not a myth. So I personally have nothing against broccoli. I think that broccoli is certainly a very healthy thing to eat, and I think that the evidence that we have from the test tube studies and from the animals is really provocative and makes us think, but the evidence that we have in people so far really doesn't tend to bear that up. And I think that this points out one of the shortcomings when we think about what do we tell people to eat to prevent cancer from developing in the first place or from coming back. And I think that that most of the evidence that we have looking at specific foods really focuses on test tubes and animals and not on people, unfortunately. So there is no clear evidence that any food or supplement can prevent breast cancer from developing in the first place or from coming back. And in some ways, that's incredibly frustrating. I would love to be able to give people a prescription that says just eat these things, and we know that's going to have a big difference for what happens. But it also points out the need for why we need studies like BWEL, is that we really don't know the answer to these questions at this point. And to be able to find the solid evidence-based information to give patients, we really need to do trials like this so that we aren't telling people, if you were a rat, I knew that you should eat this. So I think that that's really underscores why it's important to do research. But it does leave us so what do we do now? And I do think that there are a couple of other studies which do provide some more clues about healthy diets for women who've had breast cancer. So there have been 2 studies that have specifically looked at how changing diet after being diagnosed with breast cancer impacts the risk of breast cancer recurrence and breast cancer-related mortality. And the first of these studies is called the Women's Interventional Nutrition Study. Now, this was a trial that was not done in rats or test tubes, but it was actually done in women with stage 1 to 3 breast cancer. The study enrolled 2,400 women who had completed all of their standard chemotherapy, radiation. Many of them were taking tamoxifen. This was actually in the days before aromatase inhibitors. And the goal of this trial was to test the effect of reducing dietary fat after breast cancer diagnosis on the risk of recurrence. And the goal was really to lower dietary fat to less than 15% of the calories that women ate. This is a very low-fat diet. And I think it's important to note that this study was also launched in the late 1980s, early 1990s, when people really thought that the key to good health was to consuming less fat. I think that we realize now that all fats are not created equal, that there are good fats and bad fats. That wasn't really something that was a focus of research at this time period. So it's important to recognize that the goal was really to lower all fat to an extremely low level. There was also a second trial that had a very similar design that was started around the same time called the Women's Healthy Eating and Living, or WEL trial. The goal of this trial, again, was to look at the effect of eating less fat on the risk of breast cancer recurrence. But this time, the diet didn't only focus on lowering fat, but also sought to increase other elements of healthy nutrition, so more fruits, vegetables, and fiber. This study, very similar design, enrolled women with stage 1 to 3 breast cancer who had finished all their breast cancer treatment. They could still be taking tamoxifen. More than 3,000 women were enrolled in this trial, and again, they were randomly assigned to either the low-fat group or to a group that continued to eat their normal diet. Now, one of the things, again, with this type of study, it's important to know, did people actually make changes? And in fact, both studies were very effective in helping women change their diet. In the WINS trial, the women in the low-fat diet group cut their dietary fat by 1/3. So they went from eating about 30% of their calories from fat down to 20. So they didn't quite hit the 15% mark, but that was a much bigger difference than was seen, for example, in the Women's Health Initiative trial, and was a pretty significant reduction in fat. The usual diet group also cut their fat a little bit. I think a lot of times when people sign up for a study, they're very interested in making changes, and so actually both groups had reduction in their dietary fat. The WEL trial, similarly, the diet group cut their fat by about 25%. They also increased the servings of fruits and vegetables that they ate by about 5 servings a day compared to the control group. The usual diet group decreased their fat by about 4%. So in both studies, there was a difference in the amount of fat that was cut by more than 20% in the diet group versus the control group. So did this make a difference? Unfortunately, the two trials had pretty different results despite having fairly similar designs, enrolling relatively similar groups of patients, and having both studies have a focus on fat. In the WINS trial, the group that was the women that were assigned to the low-fat group had about a 24% reduction in their risk of breast cancer recurrence. The benefit was mostly seen in patients with hormone receptor negative tumors or estrogen negative tumors, and this was actually a pretty big surprise to most people. When this study was started, people really thought that things like dietary fat affected estrogen, and the theory was, when the study started, that if this program had more of an effect in one group than another, what we would see was that the women who had hormonally driven cancers had an improvement in their recurrence rates, and the patients with the estrogen negative tumors might not have as much of a benefit. But in fact, the women with the estrogen negative cancers had a much bigger change in their cancer recurrence than the patients with hormonally driven cancers. However, the benefits seem to be reduced over time. Now, it's important to keep in mind that this study didn't involve exercise, it didn't involve changes in weight, it was not a weight loss study, but it really suggested that over time the benefit didn't seem to be as great as it was initially. Now, in the WEL trial, unfortunately, there was no difference in the recurrence risk in the diet and usual care groups. And this was true for patients with hormonally driven cancers and for patients with hormone-negative cancers. And people really scratched their heads about why didn't they see the same results in the two studies. There were other differences between the two studies. My 9-year-old son would say clearly the problem with the WEL study was that fruits and vegetables aren't good for you, but I don't think anyone believes that. But I think that this has led for us, these two different studies, to not really know whether there should be a specific diet that we advise for people who've had breast cancer. And I think we've also learned a lot about nutrition and realized that there's different kinds of fat and that just focusing on lowering fat might not be the key to good nutrition. So those two studies put together have led us into a place where, again, we need more information, and especially using some of the more modern science about good fats and bad fats and other types of calories. But we, at this point, don't have any specific evidence that a particular diet is the best after you've had breast cancer. I will say that there are also a lot of other studies that have been done looking at the effects of changing diet on other factors in breast cancer patients. And we do know that changing your diet can help women feel better and can also have a positive effect on blood markers that could be linked to breast cancer. We know that changing your diet can be good for your heart, it can be good to prevent diabetes. One of the other shortcomings, however, is that most of the studies that have been done have not compared different diets. We don't really know whether one diet is better than another largely, and that again makes it hard to know, is there a best breast cancer diet? So I want to, for the last study that I'm going to talk about, is a really unique trial that was done and just finished a year or two ago called the CHOICE trial. And this study really sought to look at whether there was a better dietary plan for women who've had breast cancer, looking at lowering fat versus lowering carbohydrates. Because many of you know that there's a lot more focus now on low-carb diets instead of low-fat diets. So this study wanted to see for breast cancer patients whether there was a better dietary plan. Now, this was a relatively small study. There were only 370 women that took part in the trial. So this wasn't a big enough study to look at whether one of these types of diets could lower the risk of breast cancer recurrence. But they were able to look at whether these diets were better in terms of changing blood markers linked to diabetes and heart disease. In order to take part, women had to have had stage 1 to 3 breast cancer, they had to have finished their treatment, and they had to be overweight or obese to take part in the study. Now, this was also a little bit of a unique trial in that it didn't randomly assign women to a group, but it let them pick a group. And the thought here, the choice trial, was that if women were more interested in a low-fat or a low-carb diet, they might be more likely to stick to it. So women were allowed to pick whether they wanted to be on the low-fat or the low-carb diet, or they were assigned to a no-change diet or control. So some women continued to eat the diet that they had when they started the study. And what the trial showed was that both of these diets had benefits for women with breast cancer. There didn't seem to be a difference between the low-fat and low-carb diet in terms of improvements in blood sugar and in cholesterol. Both of these are risk factors for heart disease, and so both diets seem to have benefits for patients. Both of the diets also led to reductions in body fat. However, the low-carb diet did lead to a little bit more loss of muscle, which is not always a good thing, and I think it's important, whatever diet that you eat, to make sure that you get enough protein. So what does all this mean for a person who's had breast cancer? We've talked about a lot of different studies. Unfortunately, none of these studies has given us the information that we're really looking for, which is how do we prevent breast cancer from happening in the first place, and how do we stop it from coming back? But I think there's enough evidence there to suggest that there really are links between diet and breast cancer. I think there are studies that show benefits of many different diets for cancer survivors, low-fat, low-carb, Mediterranean. And it's important to note that these diets have something in common. Lots of fruits, vegetables, and fiber, less red meat, added sugars and processed foods, limited amount of alcohol. Really, what we all think of is good nutrition, ways that we keep our bodies healthy and avoid other diseases like heart disease and diabetes. I think it's also reassuring in some ways to know that research does not show that there is a food that you need to eat every day or a food that you should never eat. No one should feel guilty that something that they ate or didn't eat caused their breast cancer or would cause it to come back. I think the evidence that we have does not support that, but that doesn't mean that eating healthfully is not important. I also think that there's a lot of things that we still have questions about. What about healthy fats? What about sugar? There's not as much evidence in people looking at sugar despite all the headlines, and there's very few studies that compare different diets, so it makes it really hard to know what's the best dietary plan. The bottom line is that we need more evidence about whether a specific diet can lower cancer risk or the risk of cancer recurrence, but we do know enough to say that healthy eating is a good thing for women with breast cancer. Over the next 2 years, we are hopeful that through our webinars, through our newsletters, which we will be, the first version will hopefully be coming to you within the next few weeks, that we are hopeful that we can give you some evidence-based information to help you make choices about diet. We'll also be talking about physical activity over the coming months to really help make the choices that could be good for your health going forward. So I want to thank you all for your attention, and I especially want to thank you for participating in the BWEL trial. I think one of the things that as a medical oncologist, I recognize all the time the shortcomings in the information that I have to give my patients to really tell them the best ways to stay healthy. This study, which could not happen without all of you, will hopefully help us answer some of those questions. I thank you for your time. I know that losing weight isn't easy, that filling out questionnaires and wearing accelerometers sometimes seems like a lot of work, but I really thank you for participating in the science that will help not only patients with breast cancer now, but in the years to come. So that is the end of our presentation. We do have a few minutes for questions. So if you could please type your questions in the box on the side, we'll get to as many of them as possible. I also want to encourage you, we really are looking for your input for the topics of these webinars and for our newsletters. So if there are specific things that you'd like to learn about, please do not hesitate to send a message to the BWEL website, which was on your invitation, or there's also a phone number there. We really want to hear from you. If there are things that you want to hear about, these informational sessions are really made to answer the questions that you have, so please don't hesitate to reach out.
Thank you, Dr. Ligibel, for a great presentation. So a reminder to all of you, if you want to ask a question, you can go to that lower right-hand corner Q&A box and type a question, and make sure you send it to all panelists, and then we will take your questions. We'll give you a few minutes to type. Okay, so a question that comes up a lot, Dr. Ligibel, any specific supplements? What do you want to say about supplements and reducing recurrence risk?
Thank you. That's a great question, and actually as a little bit of a preview, there's some information about supplements in the newsletter that you'll be getting this summer. This is a question that we get a lot, and I think that one of the things that is definitely important to remember is that your body definitely absorbs nutrients better from food than it does from supplements. So as much as possible, getting all of the nutrients that you need through food, your body is much better able to absorb them and to use them. I will say that there are a lot of claims out there that specific supplements prevent breast cancer or prevent recurrence, but the research that's actually been done has not shown that that's the case. And I think this is one place where supplements are regulated as foods and not as medicines, and that means that people that are advertising them can say whatever they like about them, and that's scary sometimes. If you had a new medication, the FDA regulates the claims that you can make. Whenever you see those advertisements on television, they have disclaimers that go for about 20 minutes and say all kinds of scary things. But supplements don't have to do that. They don't actually have to have science to back up their claims, and I think sometimes that leads to a lot of confusion. I do think that there are some supplements that are potentially important for women with breast cancer. I think that many women do not get enough calcium, and vitamin D is also something that, especially in northern parts of the country and in the wintertime, many women do not have enough vitamin D. There are links between vitamin D and breast cancer risk, but it's not really clear that taking supplements is a strategy that can reduce the risk of recurrence. But supplements are often needed to help maintain bone health, and there are some medications that we use in treating breast cancer patients, like aromatase inhibitors, that can have a pretty sometimes dramatic effect on bone density. And if you don't have enough calcium and vitamin D, it can be harder for your body to prevent loss of bone density. So most women who are on aromatase inhibitors need to make sure that they're getting enough calcium and vitamin D. Also, at times, people who are eating low-calorie diets don't get enough nutrients, and multivitamins can be helpful. But I will say that in general, the research has not really suggested that multivitamins prevent disease, and there have been a couple of very big studies that have been done in the last few years that actually did randomize patients to take multivitamins or not. Now, none of these were done in breast cancer patients, but these studies suggested that despite a lot of health claims, that multivitamins didn't really seem to be linked to lower risk of things like heart disease or bone fractures. So, I think that it's important to talk with your doctor about supplements, but the reality is there's not a lot of evidence that any specific supplement is going to lower the risk of breast cancer recurrence. There are also times when supplements can interact with medicines. Most of them don't, but I think that that's important also if you were going to take a supplement to discuss it with your oncologist to make sure that there are no interactions between the supplements you might be interested in taking and the medicines you're taking. My own patients do take supplements, absolutely. I just always want to know what they are so that we can make sure that they're safe.
Thank you. We have another question about sugar. Can you talk about the role of sugar and cancer and the research there?
So I think one of the things that sometimes is complicated is that when we eat food, our body breaks down most of what we eat into sugars. That's sort of the energy currency of the body. And one of the things that many times has been reported a lot is that cancer cells take up sugar more quickly than normal body cells. And they are often growing faster. One of the things about cancer is that cells grow more quickly and they don't die as fast. And so that's why you end up with a tumor, because cells grow and they don't die, so you end up with extra tissue. But I think one of the things that's difficult is that even if you're eating things that are carbohydrates or other, they're broken down by your body into sugar. So sugar itself doesn't necessarily look any different to cancer cells than other things you're eating. That's just the way that your body delivers energy. There are not very many studies specifically looking at sugar in people. There are starting to be some studies in animals that have had mixed results. I will say that sugar has a lot of calories and not a lot of nutritional value. So eating a lot of sugar means that you're not eating other things that your body could need in terms of nutrients. So a diet that has a lot of sugar in it, it probably is not necessarily meeting your body's nutritional requirements. But at the same time, I think there is absolutely no evidence that if you eat a baked good every now and again, or if you eat fruit, that you are somehow increasing your risk of cancer recurrence. I think there's a lot of research that still needs to be done, but I think that sometimes the research that cancer cells are more metabolically active and use energy more rapidly than your normal cells has translated into sugar or energy being bad, and I think that we really don't have that kind of information in people.
Sounds like the key there is moderation. The next question is about the research on AIs and weight gain. Can you speak to that?
Sure. So, I think that this is one thing that a lot of women who have gone through breast cancer treatment do find that they gain weight. And there are actually a lot of studies that show that in the years after breast cancer is diagnosed and people receive treatment, a lot of women will gain weight. And there's probably many different reasons for that. Fatigue from chemotherapy and less activity. People can go through menopause, which slows down metabolic rate. There's been a lot of interest in how hormonal therapy, both tamoxifen and the aromatase inhibitors, affect weight. And I think, again, we don't have perfect information about this. There have been studies that looked at women who took tamoxifen versus placebo, and these were studies done many, many years ago. We would never do a trial like this now because we know that tamoxifen and other anti-estrogen treatments are so important in preventing breast cancer from recurring. But back before we had that information, they did studies with placebos, and in those trials, they found that women tended to gain the same amount of weight whether they were taking tamoxifen or taking a placebo. However, most women did gain weight in those studies. Similar studies have looked at changes in weight in women who were taking tamoxifen versus aromatase inhibitors, and again, showing same rates of weight change, mostly gain in women taking both types of drugs. So, I think that it's confusing because in some ways you could say, well, taking a placebo shouldn't really make you gain weight, but I think we don't really know why so many women do gain weight after they've been diagnosed with breast cancer. There's some, at least, anecdotal or sort of reported evidence that taking aromatase inhibitors or tamoxifen, some people feel it makes it harder to take weight off. Even if you're not necessarily gaining weight, you can't lose it the way that you did before. And I think, that's something that there's not as much information about that, and that we need to study that more to see if there are changes in metabolism. The one thing I will say, though, is that these drugs are so important in terms of preventing cancer recurrence that we want to try to find ways to potentially mitigate those or to reduce those side effects. And I would never, ever recommend not taking a medicine like that because of concerns about weight change, because I think the drugs are so important in preventing recurrence.
All right, thank you. And that was our last question. So thank you very much, Dr. Ligibel. Go ahead.
Okay. I saw one other one pop up about coffee. Sorry, I think this might just be on my, this is a particular favorite question of mine because I think coffee is the beverage I drink most these days. But, and I think this is actually a question that is something that we see so often in headlines, that coffee is linked to a higher risk of some cancer or lower. Pancreatic cancer lately, there has been a lot of somewhat conflicting evidence looking at people who drink coffee and the risk of them developing that cancer. For breast cancer, there really has not been consistent evidence either supporting coffee causing or being linked to increased risk of breast cancer or lower risk of breast cancer. So from my perspective, I think coffee is pretty safe. So we'll probably learn more in the coming years, but there's really no clear link between coffee intake and breast cancer.
Great question, and I'm glad you got that in. I care about that one too. All right, thank you, and thank you all for tuning in today, and huge thanks again for your participation in the BWEL trial. All right, thank you, and have a great rest of your day. Bye-bye.